One of the main precursors of renal failure is obesity. From obesity we get diabetes and hypertension, which are two of the main precursors of renal failure. So what we're trying to do is we're trying to say, listen, if you want to try to beat this obesity thing that's going on at the moment, which is on the increase, we need exercise. We need exercise, we need to watch our diet.
A lot of these conditions, and I refer to them as conditions because I believe that certain conditions can be controlled. If you look after yourself, if you eat the right foods, if you exercise, if you don't overdo it with alcohol and other such substances, and you do everything in moderation, this will ultimately and hopefully contribute to a healthier population.
The diet is important. Low sugar diet, low fat diet, low salt diet should be practiced by everybody. This is what we call the healthy eating lifestyle. Besides avoiding salt as much as possible, one should also restrict the amount of protein in the food. There's some evidence that restricting protein in the food delays the progression of kidney failure. However, it's important that this is done under a supervised dietitian, because the danger there would be that the patient becomes malnourished, and which is even worse than the kidney problem itself. So it's important that any diet is individualized. It depends on the stage of your kidney disease. If you have early kidney disease, you do not need to restrict protein, and basically it's a healthy diet.
As regards diet, we have to eat a healthy diet. We have to take care about our salt intake as well, because that extra salts can predispose to hypertension. And we have to drink a lot of water. Water is very, very important. And obviously do regular exercise.
Another important factor is exercise. People who do exercise normally look after themselves to a better extent. Other conditions like high cholesterol levels, poor circulation, high glucose levels, as in the case of diabetes, are all contributing to unhealthy lifestyles.
Yes, exercise is very important, as part of a healthy lifestyle, to prevent the diseases that can cause kidney failure in the first place, such as diabetes. So exercise and weight loss are very important. Obesity is linked to kidney failure, as is smoking. Incidentally, there are very important risk factors for kidney disease. So once the patient has kidney failure, research has also shown that exercise, which is brisk walking 3 or 4 times a week, helps to delay the progression of kidney failure, quite apart from the fact that it does all sorts of good things to your cardiovascular health, not just on the kidney, but to your heart, etc.
Treatment is not easy. It's tough, it's difficult, it's enduring, it's a big commitment. However, on a positive note, it is not the end of the world. I see patients who are living, most of their lives having to have treatment 3-4 times a week for several hours each session, but they are positive. They have a very positive attitude. They do their best to lead a healthy lifestyle, and they look at life very, very positively. They continue with their life, they travel. Again, it's not easy. It's not an easy life.
Remember, chronic kidney disease is a lifelong chronic condition. Even if you get a transplant, you still have to come to hospital and have the checks. So it's a lifelong disease that you can never really get off. So it does take a toll on your psychological state, not only yours, but the family. The kidney problem is a family problem because all your relatives and loved ones are involved in the disease. Depression can be common, just anxiety. It takes a while for the patient to accept that he or she has this chronic condition. And for this reason, we make sure that all our patients get access to a psychologist that can help the individual to better deal with these chronic condition. So a positive attitude has been shown to actually improve the quality of life tremendously, and also possibly even delay the progression of kidney failure in patients with this condition.
You have to experience what they have to go through. It's tough. It's tough. However, as I said before, it's not the end of the world. A lot of them look on the bright side of things. My appeal to these patients is be strong. Be strong. Keep on, living a healthy life. One of these days, you will get the opportunity for a donation. Somebody who is altruistic, somebody who has signed that donor form, and one of these days you will get the chance for a new kidney, and it provides obviously a new lease of life.
So the main things to consider right now are a healthy diet, plenty of exercise, be kind to yourself, and always aim to have a positive outlook on things. Always remember that there are many people around you willing to assist you whenever you need and who understand what you are going through. Don't be afraid or shy to ask for help, and always, always be grateful for being alive.